More of the John and Ken Show. John Cobell and Ken Shampoo. KFI, AM 640. So it was Hillary and Bernie last night.
Yeah, this is the last Democratic debate before people start to vote, beginning February 1st in Iowa. So is Hillary in trouble in this race or not? Who knows? But anyway, and it's funny, when they polled people afterwards, Democratic insiders say Hillary smashed them. They polled Republican insiders, Bernie smashed her.
Yeah, that's...
I didn't watch it. I don't know.
That's phony baloney spinning.
Both sides.
Yeah.
Both sides. Here is Bernie Sanders versus Hillary. Subject health care. To give you a little context to this, Bernie Sanders pretty much wants to move well beyond Obamacare into universal health care. Hillary thinks that's like starting over. Let's listen.
The Democratic Party in the United States worked since Harry Truman to get the Affordable Care Act passed. We finally have a path to universal health care. We've accomplished so much already. I do not want to see the Republicans repeal it, and I don't want to see us start over again with a contentious debate. I want us to defend and build on the Affordable Care Act and improve it.
What her campaign was saying, Bernie Sanders, who has fought for universal health care for my entire life.
I love the accent.
He wants to end Medicare, end Medicaid, end the Children's Health Insurance Program. That is nonsense. What a Medicare for All program does is finally provide in this country health care for every man, woman, and child as a right. But right now, what we have to deal with is the fact that 29 million people still have no health insurance. My proposal, provide health care to all people, get private insurance out of health insurance, lower the cost of health care.
Stop a second. I read this would cost tens of trillions of dollars over
there's another one of those stories floating around today.
And right? So they'd have to tax everybody. Of course, you wouldn't pay insurance premiums anymore, but
Medicare for all.
And they could argue about the numbers to doomsday because nobody knows for sure what happens until you get there. So I don't believe anybody's numbers. But it's about trusting the least intelligent block of humans in our society with the thing that's most important. Most important thing to everybody is health care. And when you get sick, how does the system work for you? Now you're going to turn this over to the duds in government?
Here's the details. The Sanders campaign says $1.38 trillion per year, which would come from a new 2.2% income tax on all Americans and a 6.2% levy on employers. He would also like to hike tax beyond the 2.2 on the wealthy.
Now, since I don't care about everybody's problems, and I really don't, I'm going to give up a system that works well for me. You know, we've got union health insurance.
He says that could be scrapped under this plan.
But why would I want to scrap it?
Your private insurance premiums would go away.
Yeah, and then I would get taxed up.
You'd probably, I know. What you and I pay, we'd probably get up your colon.
Oh yeah, no, they'd be.
I think we'd end up paying more, right?
Oh, they did.
But he thinks the average American might save money, because they wouldn't be hit as hard by the income tax increase, and then they'd lose their health insurance.
That's what
premium.
he thinks, and that might happen. But who the hell knows?
No co-pays or deductibles under his Medicare for All plan. Right? Says here people pay an average of $1,312 a year in deductibles. So, and families shell out over $2,000 in deductibles.
But you got to trust government duds to manage this.
That's just what I'm worried about, right?
And if it doesn't work, good luck rolling it back. You're going to destroy the health insurance companies, right? They'll all go out of business. And they won't be around if the government system goes up in smoke. And I'm sorry, after living long enough, my encounter with government people is
not good.
Not good. It's I don't trust you. I don't want to be fighting with you. It's bad enough, having these problems with the insurance company, but at least at some level they have to please me, right? At some level I'm a customer. So they can't completely squat on me. I've got a little bit of leverage. I am paying them a bill.
One thing we haven't even talked about is what happens to the actual medical side of this. What are doctors going to do? I mean, I've seen doctors actually have signs. They're not taking Medi-Cal. They're not taking Medicare. And they're not even in your plan. In other words, you and I with our union health insurance, we have doctors that are in the plan, doctors that are not in the plan. Right. A lot of them are not. So
well,
everybody want to deal with all that.
Every doctor would become a government worker.
Oh.
Now, what?
That could really kill the profession into the future.
And the reason they don't want to deal with Medicare and Medicaid is they don't get paid much for those patients. Now, if you take away the financial incentive of being a doctor, why would anybody want to be a doctor? It is grueling.
It takes many years of training. It's very expensive, obviously, med school.
Yeah, you're not done being trained until you're about 30. And then you open your practice or you join a practice.
And a lot of them have much debt.
You got 6 figures worth of debt.
Then you go to work for the government.
Yeah. And then
what they might call doctor's minimum wage.
So and who do you appeal to when this doesn't work? If I have a problem, I got to depend on the government. I can't cancel my insurance and say, you know what, you're a bad company. I'm going with a competitor. You have no leverage. What am I going to say? You're a bad government. I'm going to apply to Canada. And the same thing with the doctors. If they pay them badly, they don't reimburse them properly. Who are they going to go to right now? If they have an insurance plan or Medicare and they don't like the way it's working, they could opt out and say, you know what, I don't take this insurance. I don't take Medicare. You pay me cash or I go, I'll take other patients.
All right. When we come back, we will play the clip where Bernie Sanders is asked about previous comments on Bill Clinton's behavior with women. Donald Trump is raising it on the Republican side.